Are you thinking of having another baby and have had a sterilization procedure in the past? If so, then a robotic tubal reversal might be right for you and give you that second chance at a pregnancy. Robotic surgery is a highly precise and minimally invasive way to perform delicate surgery such as a tubal reversal. For the surgeon, it provides a platform of precision because of its three-dimensional magnification of the operating field and the precise movement of the instrumentation with its downward scaling of movement, thereby eliminating any tremor at high magnification. In an open procedure, a surgeon will use jeweler's loops to visualize the surgical field. No matter how steady his hands are, there is still a small amount of tremor at high magnification. The high magnification using a robotic technique allows a surgeon to easily identify and surgically manipulate the tiniest of organs, such as the fallopian tubes, for the best success rate. For the patient, it offers minimal blood loss and less pain because of the size of the incisions and allows the patient to return to her normal activity more rapidly. Success of pregnancy after having a tubal reversal is dependent on many factors. First, the fertility of the patient and her partner must be assessed before undergoing any procedure. It does take two to tango, and it's a no-brainer that before assessing the female component, it is important to check the sperm count of her partner. This is an easy and simple test to collect and performed. Once this is done, and a semen analysis is normal, then a woman's potential fertility can be addressed. The first thing to consider is the age of the patient and any underlying diseases such as endometriosis or pelvic adhesions. Women under 30 years old have a better than 90% chance of conception if she's ovulatory. Her tubes are patent, that is, they're open, and her partner has had a normal semen analysis. A simple way to assess if a woman is ovulatory is to review her menstrual history. If she has regular periods, that is, if she can look at a calendar and know when her next period is going to start, then she is probably ovulating. Other blood tests can also be performed to assure ovulatory ability. After age 35, however, egg quality diminishes and the success rates decline. The next thing to assess is the length of the remaining tube and the type of procedure that was performed. Some types of sterilization procedures are permanent and fertility cannot be restored. Procedures such as the removal of a fallopian tube or the occlusion of a tubal opening inside the uterus, either by an ablation technique or placement of implants such as the Escher method, are such procedures. When the type of sterilization procedure has been determined and sufficient length of the tube remains, a tubal reanastomosis can usually be done. For best results, there needs to be at least 5 centimeters, or roughly 2 inches of tube remaining. This provides the minimum optimal length for fertility. Fertilization of the egg occurs in the fimbriated end of the tube. The egg travels down the length of the tube until it implants in the uterus about 7 days later. This time period is critical for successful implantation of the embryo in the uterus. A shorter tube allows the egg to travel too rapidly through the tube, thereby not allowing sufficient maturation of the developing embryo before implanting, and this decreases the chance for success. A tube of less than 3 centimeters has only a 5% chance of resulting in a viable pregnancy. After tubal reversal surgery, a hysterosalpingogram, or HSG, is done to determine the success of the procedure. It will determine if the tubes are open or not. This is done by injecting a dye into the uterus and watching the dye fill up into the tubes. If the tubes are open, the dye will spill out of the tubes and you may try to conceive. A serious risk factor after having a tubal reversal is the chance of having a tubal or an ectopic pregnancy. This occurs when the tube scars during the healing and restricts the diameter or the motility of the fallopian tube. The developing embryo cannot pass through this area of the tube and becomes lodged in the tube. This results in a tubal pregnancy. The rate of tubal pregnancy after a tubal reversal is about 8%, or about 1 in 12. For this reason, it is important to begin monitoring your pregnancy just as soon as you find out you're pregnant. It is very important to ensure the embryo has implanted in the uterus and not the tube, as this can be a life-threatening complication if the tubal pregnancy ruptures. For women who have had a tubal ligation and are good candidates for tubal reversal, consider a robotic method for restoring your fertility. The success rate is high, it is less painful than traditional methods, there is less blood loss, and you will return to your normal lifestyle quicker. If you are over 35, have a tubal length less than 3 centimeters, or your husband has a low sperm count, you should consider alternative methods such as in vitro fertilization. However, if you feel this may be a good way for you to have a second chance in achieving pregnancy, please call us and set up a consultation.